South Australia's Deputy Coroner has called for an overhaul of laws covering home births after an inquest into the deaths of 3 newborn babies. The inquest found the deaths could have been prevented if the babies had been born in a hospital, as Lucas Fountain reports.
The 3 infants died between July 2009 and October 2011 during or soon after separate home births involving the same midwife, Lisa Barrett. An inquest into their deaths only went ahead after a legal battle over when a baby is considered alive under the law. The inquest heard that Ms Barrett had deregistered herself as a midwife early last year after the first 2 deaths and now works as a birthing advocate. It was also told she'd been involved in the delivery of another baby which died in similar circumstances in Western Australia. The Deputy Coroner said in relation to the 2 deaths after her deregistration, it was obvious that Ms Barrett was performing the clinical duties and responsibilities of a midwife and was not merely present as a birth advocate. His recommendations include legislative changes making it an offence to practice midwifery without being registered under national law and forcing practitioners to notify the Health Department of planned home births. Mr Chappell also recommended the setting up of alternative birthing centres be considered and better education about the myths and risks associated with home births. The state government and the Health Department have promised to consider the recommendations.
I think this will be a groundbreaking finding which will be debated extensively, not just in South Australia but around Australia.
Medical groups have supported the recommendations of legislative change and better education.
I am concerned that the misconception about what happens in hospitals actually requires a broader campaign and actually requires a level of understanding which is not currently in the community.
Lisa Barrett wasn't available to comment on the findings. Lucas Fountain, Lateline.